Good morning, Colorado. Today we're going to talk a little bit about what I call Insurance 101, and that's kind of breaking down the basic pieces of a health insurance policy. And it's kind of interesting because most people think they understand what all the terms mean for health insurance, but oftentimes when I talk to them, they misunderstood one or more of the different terms. So it is important to understand the terminology of health insurance, because if you don't understand what the moving parts mean and what the terms mean, then you really aren't going to be able to understand how your policy works. And it's very important to understand the fundamentals so you can make sure that you're getting the best possible policy for your needs. So anyway, some of the basic terms that we're going to talk about are things like copays, deductibles, and probably the most confusing element of all, which is coinsurance. And that's something that frankly, very few people really understand how that works. So in a typical policy, as an example, with a silver, now remember we're talking about ACA compliant health insurance plans, which are defined by metal classes, meaning they have platinum plans, which are pretty rare in this day and age, but those are going to be the most benefit-rich plans, followed by gold. Silver plans are going to be kind of a pretty common intermediate type plan. Then the bronze plans, which are going to be the lowest cost plans for most people. Then there's also catastrophic plans, which are only available to people under the age of 30, or who meet some specific requirements. But anyways, with all of these plans, and let's just take a silver plan as an example. And matter of fact, I'm going to pick a plan that I was just talking with a client about. It's a silver plan with a $3,000 deductible, 70/30 coinsurance, and then it's also got copays for primary care doctor visits. So that all sounds good when you're looking at it, and certainly that sounds attractive, but let's talk about what each one of those moving parts means. So as an example, for this particular policy, the silver plan, it has a $3,000 deductible, has 70/30 coinsurance. This plan has $30 copays for primary care office visits. It has 30% for coverage for specialists, $75 copays for urgent care, and $500 copays for emergency room and hospitalization, and an out-of-pocket maximum of $81.50. Okay, so let's break that down. So first of all, the $30 copays for primary care, that's pretty simple. Now, mind you, with any ACA compliant plan, all federally mandated preventative care is going to be free to you as long as it's coded as preventative care by the doctor and done in network. And that includes most routine physicals, the common lab work associated with that, as well as age-appropriate mammograms, well-woman exams for women, the regularly scheduled pediatric exams for children, as well as things like mammograms that are age-appropriate for women, and colonoscopies can be covered for people over the age of 50, as long as it's coded as preventative care. So all those things should be covered at no cost as long as it's done in network and, again, coded as preventative care by the provider. So, and just as a quick aside, sometimes people can go in for a routine physical, and then the doctor may ask how they're feeling, and they could say, I'm feeling great, except my arm hurts when I move it like this. And that complaint may have just caused the doctor to check a box, turning your free preventative care into a diagnostic exam, in which you may be subject to the $30 copay I was talking about earlier for this particular plan. So the $30 copays are going to apply for non-preventative care visits with a primary care physician. That typically, by the way, does include gynecological exams for women. And anyways, the $30 copay is, let's just call it a sick visit. You go in with some sort of complaint to the primary care physician, and you would pay the $30 copay in the doctor's office. Now, let's say that you need to see a specialist, maybe a dermatologist. That's a real common thing in Colorado with the prevalence of skin cancer and people wanting to get their skin checked out. So even though you may be going in without a specific complaint to the dermatologist, that's not going to fall under the federally scheduled preventative care benefits. And as you may recall, we were saying that for specialists, the coverage said 30%. Now that's a little misleading because you may think that you just pay 30%, right? But no, that would be subject to the $3,000 deductible first, then it would be covered 30%. So if you haven't met your deductible, then you're going to be out of pocket for the cost of that specialist office visit, is the long and the short of it. And by the way, when you do go to specialists, take care. Many plans do require that you get a referral from a primary care physician. Some do, some don't, but that's something you'd want to look into for your individual policy to see whether or not that is going to be a requirement. So anyways, next we were talking about this plan also has $75 copays for urgent care. Now this is a real money-saving opportunity because let's face it, often when you get sick, it's at the least convenient time, often at night or on the weekend when your doctor's office is closed, or maybe you just can't get an appointment at your PCP. So anyways, urgent care is typically going to be much less expensive than going to the emergency room, as an example, which could easily save back $800. So it's always worth looking at your policy to find out if you have copays for urgent care, and if so, that's going to save you a ton of money. In our example case, that would cost you a $75 copay for that office visit. Now, we also mentioned that the plan has a $500 copay for emergency room or for hospitalization. And in this case, that's going to be the minimum charge that you would pay. And often in the case of hospitalization, it would be a $500 copay plus being subject to the deductible and then covered 30% coinsurance. So it's important to understand that. And now we were talking about the plan had the 70-30 coinsurance, and anyways, the way that works is after you reach the $3,000 deductible. So you pay the first $3,000. After you reach that $3,000 deductible, then the insurance company pays 70% and you're responsible for 30% of the costs until your total out-of-pocket costs reach the plan's out-of-pocket maximum. In our example policy, that was $8,150. So again, what contributes to that $8,150? The $3,000 deductible, the 30% coinsurance, that shared amount that the insurance company is paying 70%, you're paying 30% until you reach the out-of-pocket maximum. Also, any copays that you may have paid for primary care doctor visits, for urgent care, for emergency rooms. Oh, and let's not forget about prescriptions. Many silver plans also have copays depending on the type of prescription that one might be taking. They may have different copays for generic drugs or for inexpensive brand names, and potentially even higher copay for more expensive brand names. And then with specialty medications, those would typically have a very high copay or often be subject to the deductible, $3,000 deductible, and then 30% coinsurance. So again, with the out-of-pocket maximum, all of those expenses, the deductible, the copays, the 30% coinsurance, all of those amounts add up. And once you hit that $81.50 out-of-pocket maximum, that's it. You're done, at least for that family member. The insurance company will pay for 100% of all covered costs above and beyond the plan's out-of-pocket maximum for the remainder of the calendar year. And as we touched on in yesterday's video, by the way, there is a cap of no more than 2 out-of-pocket maximums per policy per year. And that comes into play if you have a family with 3 or more family members on a policy. Thank goodness you're not responsible for 4 or 5 times the out-of-pocket maximum. The plan starts paying for 100% with no more than 2 times the out-of-pocket maximum, which was $81.50 in our example. So there you go. Now you know a little bit more about the different moving parts that you'll commonly find in health insurance policies. Certainly there are a lot of nuances depending upon the plan, and it is absolutely worth talking with a licensed insurance agent to make sure that you're really understanding all the different moving parts of the insurance policy. And let's not forget about the differences in the networks, as well as prescription drug formularies, and there's quite a few other things that are absolutely worthwhile discussing with a licensed insurance agent to make sure that you understand how your policy works. The last thing you want if somebody becomes very sick or is injured is to get a surprise, to not understand how your policy is going to work. And the best way to do that is simply to go to www.betterwaycolorado.com. And there are 3 buttons you're going to find there where you can get a quote on a policy for yourself, for one person, or another button to get a quote for your family. And then there's also an option if you are a small business owner or a principal in a business. We can also give you quotes on business health insurance policies, whether you're shopping the one that you have today, or perhaps you're considering setting up a brand new health insurance policy for your company. We're happy to assist with that as well. Again, the website you go to is www.betterwaycolorado.com, and that's the easiest way to get to our website. Or you can just type out www.coloradohealthinsurancebrokers.com. It's quite a mouthful, but that'll get you there as well. So anyways, I hope you are having a terrific day, and we'll catch up tomorrow with some more updates. Thank you. Bye-bye.